You know something, I have to tell my audience out there that I have the most incredible life, because every Tuesday I get all my guests, all these different people that come on, and I learn so much. They think they're learning from me. Well, I'm actually learning from them. They've all got such different stories, and you know, I don't have a pre-interview, because when you actually think of somebody's life, it's kind of their life and it's kind of their thing. So I kind of like it very, very fresh and very much out there to find out. And this young lady, Zandra, is actually, she's not a therapist, but she deals in the body, mind, and all that, you know, goes with it. Well, now I'm going to get a lesson from her, and I'm going to learn how to take care of my body. My mind is completely gone, so we won't even worry about that. Zandra, how are you?
Hello, Ninon.
You okay?
Yes, I'm fine.
Are you fine?
Yes, I'm well, I should say.
You're well. Well, you should be well, because you're in the wellness business.
Absolutely.
Now, why is there so many wellness businesses out there now? Everybody in the entire world seems to be trying to get well from what?
Yes. Well, I have to say, unfortunately, here in Las Vegas, there are many mental health agencies available. However,
No, you said mental health. I just said health.
Well, I'm in mental health, mental and behavioral health.
Mental and behavior health.
Yes. And so we're called mind and body behavioral health because one affects the other. The mind can affect the body and the body can absolutely affect the mind.
Really?
Right? Yes.
So they kind of go hand in hand
Absolutely.
in opposite directions.
Absolutely.
Because you've got your body was going crazy, that makes your mind going crazy, your head's going crazy, makes your body go crazy. So why is it so prominent, number one, in Vegas? Why is this? Is it the lifestyle here?
The lifestyle has a lot to do with it, and I just want to mention that I'm Director of Business Relations for Mind and Body Behavioral Health Services, and so I'm very careful.
You don't teach it. You don't teach it, but you see it.
Yes, absolutely, I do see it every day.
Yeah. So we're talking about, does it affect you? Does it affect your mind? When you see how somebody walks in, do you kind of understand what their problem could be, not is, could be?
Absolutely not, because I do not diagnose and I do not judge anyone that walks through our door.
Oh, okay. That's cool. I like that.
Yes. But I do deal with mental health in passing every day.
Yeah.
I have family members who are dealing with mental health. And that's how I kind of got into this business. I studied it in school, but then I was dealing with it day to day at home, so to speak.
I like it. Now, what was going on at home with mom and dad and the kids?
Well,
your husband and your kids.
Well, I think just my family as a whole. You know, I think it's mom, dad, brothers, sisters, cousins, aunts. You know, and there's no such thing as normalcy, and so truly, and so you know, when I went to school for psychology, it was like, you know, a lot of things started making sense. 2 and 2 made 4. Exactly. And I became more and more interested.
Did you like that, or did you sort of, I don't know whether you liked it or not, but I think you probably understood it more, right?
Absolutely. And it also changed my parenting style.
Really?
Absolutely.
You have children?
Yes, I have 4 children.
4 children?
Yes.
Oh.
22, 19, 15, and 9.
22?
Yes, 22.
So you had that. Okay, all right. We'll put 2 and 2 together and we got your age, roughly.
Yes.
So you've been able to handle your family and your children and also your parents a little different than if you hadn't gone to psychology?
Absolutely. You know, it's like once you know better, you do better, right? You
make
those adjustments.
I like that.
You make those adjustments.
Yes.
A responsible person makes those adjustments.
A responsible person. There's not too many responsible people out there.
Yes.
Everybody I find, and you might, well, because you don't judge them or anything else, but I find that a lot of people out there do not want to be responsible. There's a big dilemma going on out there that everything's passed on to somebody else, or it wasn't them, or it's, you know, they don't like to take on responsibility.
Sure, that's very broad across the board, but in terms of mental health, the responsibility of continued care is an issue.
You know, when we talk about this, and I talk about it as a layman, But then you bring in mental health. Now, when you say mental health, you immediately mentally, what's going on mentally. It's such a dramatic word. It's such a strong word that mentally you are or you aren't, imbalanced or whether. Why do we use that word so often and frequently?
Well, I think more so the problem is the stigma behind
that's what I'm
hearing
saying.
it. Because, again, well, not again, but as we all know, if we break our arm, we go to the doctor, we get a cast. If we have an excoriation, mom comes and cleans it off, puts a Band-Aid on it. But then there's the stigma with getting mental health.
Yeah.
And a lot of times we feel like, if we just talk to mom or my close friend, that'll
solve the
work.
problem.
Right. But that's not a trained professional, and sometimes we have to go outside of our comfort zone and speak to that professional who can help direct and kind of guide us a little bit better.
I'm trying to get you understand what your problem is. I don't want to say
Sure.
mental problem, but that's what they're using. Because when you use that word mental, it's so downgrading.
Sure.
It hurts. I think it hurts somebody when they, you're mentally imbalanced. I mean, that's really dramatic, isn't it, to somebody?
But through education and intervention, we're seeing some great outcomes. With the millennials, when I go and I speak to millennials, when I go places, they're just they're moving past that stigma, and they're understanding that if you need help, to reach out to a professional. And they get it more times than the adults do.
Now, what age bracket do you talk to?
I'm talking to 18 and over.
18 and over.
Yes, because under 18, a parent will need to be there.
To be there, absolutely.
Yes.
So it's 18 and older.
Yes.
So what do you see with an 18-year-old, or what they when they ask you questions, do they ask you a lot of questions, or do they just sit and listen?
Well, they will ask me questions. First, they want to know what type of insurance. Do they have to have insurance? Our agency is insurance-based. So yes, you would need to have insurance to come and see us.
Well, I would have thought that would be the last thing you'd ever ask is what about insurance when I mentally need to help.
Well, some people are doing just cash pay, and so others are relieved that we are insurance-based.
You are covered.
Yes.
They are
covered.
That they are covered.
And that their insurance will take care of it.
So their insurance will take care of their visits.
Yes.
If they need some, I hate to say it, mental health. I just don't. That word is so strong. Are you seeing more of the younger generation needing mental health?
I'm seeing more of the younger generation and parents getting their children involved with getting mental health services. And the discussion is a lot more open, again, with the millennials. And I like to see that because they're understanding that it's important to get that, to feel that need with a professional.
Is it better for them to understand the word and that they're not mentally sick? Because I think understanding the word...
Well, a lot of times, reaching out to a professional doesn't always mean that there's a diagnosis that may be, there may not be a diagnosis. There may just need to be some counseling.
Yes.
Or maybe there just needs to be some intervention with family. You really don't know until you do
until you're actually stamped with a name. And that's what I'm trying to get out there. I'm trying to get out with that because the younger generation are very delicate. I dealt with them for many, many years, but mine were from 12 to 18. And, I would never have ever thought of any of them being mental. Never, ever. That never, in my time.
Diagnosed.
No, that was in my time. It never even came up. It was never thought about.
Okay.
But with this day and age and what's going on, it's a different way of thinking and it's a different way of going. And now they're.
But we don't say mental.
Yeah, we can't. No.
And the
so
millennials.
when you go to go and teach children over 18, what do you call the course?
What do I call?
What do you call the course? What do you call? You're coming in to speak. What do you call it? You're just coming in to give them a lecture on what?
Okay, I don't come in to talk to them about mental health.
No, that's what I'm saying. So what do you call it?
No, I work with business to business relations.
Okay, business to business.
Yes.
So you're teaching them like a kind of a business course or...
I'm not teaching the kids
You're not teaching anything. You're just,
no.
what do you do? Then
no,
what do you do?
What happens is when I meet millennials, they are very open in discussing.
Oh, okay.
Oh, yeah, I've been diagnosed with this, or I've been diagnosed with that. I'm seeing someone. And I say, great, that's wonderful. But there are also times when, you see young adults that are going into the hospitals and then they're not getting that continued care. And that's what we provide, is that continued care after a crisis, or to prevent
a crisis.
Yes.
So they can actually come to you. I see you've got a little pamphlet there, mind and body.
Yes.
So they can actually come to you to be diagnosed actually with whatever they have.
Not to be
or what
diagnosed.
they've been diagnosed with, and now they want to know more about it.
Sure.
Okay. Is
Sure.
that what you do?
That's what our agency
Your
does. So
agency
we
does.
have therapists. We have our CEO is actually a clinical psychologist, which is rare in the city of Las Vegas, that the owner is trained and educated in the discipline. So I'm very proud of that in working with this agency.
Okay.
Also, we have 2 psychologists, one for adults, one for children. We have a registered nurse, and we have 5 licensed clinical social workers. We have 3
So
locations.
social workers means they take care of the young children.
Those
that
are the ones that do the therapy.
Therapy.
Yes.
Yeah.
And we have 3 locations. We have one in Las Vegas,
Okay.
on Rainbow and Sahara. We also have a location in Pahrump. And we have our new location coming in November near our office on Rainbow, which is on Torrey Pines and Flamingo.
Okay. So you've expanded obviously because the program is needed. You
Absolutely.
think it's very much needed in Vegas because of the lifestyle of Vegas?
I think it's needed generally because it's just as important as it's a way of taking care of yourself.
This is funny
and
because,
knowing how to take care of
because
yourself.
in my time, you wouldn't go to a psychiatrist or anything like that until something was really dramatically wrong. And, then even if you did go, you wouldn't tell anybody. But now it seems to be, as you say, you're opening up your third place. Now, opening up a third place means it's needed.
Yes.
And obviously people out there, that they need this guidance. So what has kind of fallen through the cracks of people in this condition or think they've got a condition? What has fallen through the cracks?
What's falling through the cracks is the continuum of care. So a lot of times what can happen is there can be a crisis. Someone goes into the hospital, they go to emergency, they go into a mental and behavioral hospital for a few days, and then they're released. And then what? Then before they're released, the case manager gives them an outline of things to follow through on, right?
Yeah, or outside help.
Resources.
Outside resources.
We would be one of those resources.
Outside resources.
And so along with, if there is medication prescribed, along with that treatment, there needs to be therapy, because the therapy can help with reducing the amount of medication needed.
Do you think
right?
too much medication is sort of put out there?
Well, it depends on if you're receiving therapy or not. It goes hand in hand. You can't have one without the other. And if you're imbalanced with not having both, then there's going to be some issues. If you're just receiving therapy and you may need
Cocktails, please. Cocktails.
and you may need medication,
Yes.
then that's an imbalance. If you're just taking medication, you're not dealing
With the problem?
with your issues, then that's an imbalance.
This all really comes a little bit complicated in my day and age. I've never been to any of these people, and I'm not putting any of it down. I think it's great to have it out there, but I think you're having a lot more younger people coming to this situation of them trying to find out where they're going wrong or what do they need to do.
Not being afraid to reach out for help.
Yeah, not being afraid. And that's what you're actually saying, is don't be afraid to reach out help. So how can they get hold of you?
You can get a hold of us by calling our office. Our phone number is 702-478-7444. Give us a call. We take all insurance, and we're here to help and serve.
And
So
aren't
please
you
give us
doing
a call.
something tomorrow night or something at a radio show or something
Yes.
happening? I've got to remind her what she wants to talk about.
Yes, thank you. So, actually on Saturday, okay, let me back up some more. It is Minority Mental Health Awareness Month.
Okay.
And in this month, we will be, actually this Saturday, July 20th from 12:30 to 2. We will be at the Doolittle Center, and that address is 1950 North J Street in Las Vegas from 12:30 to 2:30. We partnered with the NAACP, and we're trying to do our part by bringing education and intervention to help reduce the stigma of mental health.
Yes.
And we would love to see the community to come out and support. And with that, that means tomorrow we will be on the breakdown on KCEP 88.1 from 6 to 8. And our panelists will be discussing what we'll be talking about this Saturday at Doolittle. And our featured panelist is my CEO from Mind and Body Behavioral Health Services, Dr. Clarence Perot. We will also have Gail Lawson, who is the president of the Las Vegas Black Social Workers, or Black Social Workers of Las Vegas Association. Don't kill me, Gail.
She's getting it out there. Don't worry, it's coming. It's coming. I can't help her because I don't know.
Yeah. And then we have the wonderful Dr. Michelle Giddings, who is an APRN out here in Las Vegas.
Yes.
And she works with children. And also
Got a
we
big lineup here.
we do. We have
Great
Dr.
lineup
Melva
for
Thomas
this.
from UNLV. And then we also have Monique McCoy, who is a licensed MSW.
So they're all going to be talking about, not mental health, but talking about body and mind and how to...
They will all be talking about mental health and
mental
how it
health
affects the
and how it
community.
affects. So it will be all
Yes.
talking about mental health.
Yes,
So,
absolutely.
and opioids.
These are all
what is
mental
it,
health
opioids
professionals.
or something, this new epidemic of this, is that part of what you will be talking about
I'm
as
sure
well?
it's a big Q&A,
Big
so
question.
please come out with your questions.
So you can come out
Yes.
with any question on these opioids? Or what-
Opioids.
Opioids?
Yes. Or you can
sorry.
call in to KCP 88.1 tomorrow
What's the phone
on the
number? Do you have
breakdown
do
from
you have
6
the
to 8.
phone
I
number?
don't know the phone number.
That's
I'm
okay.
sorry.
We got where you can call. But
Yes.
I think this is going to be very helpful to a lot of people out there. I'm not going to say a lot of people need it. Whether you need it or whether you don't need it, it's still nice to know what is going on out there in the mental world of, the world. What's happening out there. Because there's a lot of stuff going on with, especially with the medication that was prescribed to you. A lot of stuff is prescribed to you. Sometimes you need it and sometimes you really don't need it. But as you said, you've got to have the healing and you've got to have, everything's got to be in sync
balance,
together.
yes.
In balance together. So you've been amazing. Thank you very much
Thank
for
you so
coming
much
on.
for having me on and
we're helping the
helping.
world.
Yes.
We're helping everybody.
Helping to spread the message, so
message
that
out
we can
there.
reduce the stigma
And
get the
nothing,
help.
I'd reduce the stigma because nothing's really that bad ever out there. So believe me, don't think you've got something wrong with you. You have not. They're out there to explain what it is, how it is, and why it is. You probably just have nothing and you just think all this stuff is going on. It's not. So let's hope that's what the case is.
Yes.
So you don't have to take medication and you don't have to keep going to the offices and finding out what you should do or shouldn't do.
Or if you need to take medication, learning how to manage that medication.
as well.
Yes.
Okay. We shall be right back. Vegas Live with Ninon.